बिस्मिल्लाहिर्रहमानिर्रहीम अस्सलामुअलैकुम। वेलकम टू दिस एक्सप्लेनर। अगर आप नर्सिंग प्रोफेशनल हैं और अपनी एजुकेशन एडवांस करना चाहते हैं, स्पेसिफिकली फॉल 2026 में मास्टर ऑफ साइंस इन नर्सिंग यानी MSN के लिए, तो ये रोड मैप एब्सोल्युटली क्रूशल है आपके लिए। वी आर गोइंग टू ब्रेक डाउन दिस एंटायरली न्यू सेंट्रलाइज्ड फ्रेमवर्क स्टेप बाय स्टेप।
Okay, let's dive into this. A completely new reality has emerged for all candidates pursuing an MSN. You see, old admission structures completely khatam ho chuke hain, and for 2026, the rules have totally changed. Early preparation is absolutely critical yahan par.
Here is a quick look at our agenda for today. The 2026 admission policy shift, H84 for nursing candidates, a detailed exam pattern breakdown, assessment and passing criteria, and finally, the ETC portal registration guide.
Section 1. The 2026 admission policy shift.
So exactly क्या change हुआ है? Under the 15th May 2026 policy shift, individual public and private universities no longer hold testing authority. Instead, a centralized HEC/HETV exam has been established, managed entirely through the ETC portal. इसका बेसिक मकसद पूरे पाकिस्तान में एक ट्रांसपेरेंट और यूनिफॉर्म मेरिट सिस्टम नाफिज करना है। It's a completely level playing field now.
Section 2. HAT IV for nursing candidates.
According to the official HEC classification, nursing is explicitly grouped under biological and medical sciences. This basically means that all MSN candidates must register for the HTV4 category. Right? The academic prerequisite is 16 years of education, meaning an accredited 4-year BSN or a 2-year post-RN BSN degree is absolutely mandatory.
Section 3. Detailed exam pattern breakdown.
So, what does the exam actually look like? The exam format is completely paper-based. The duration is exactly 120 minutes to complete a 100-question comprehensive exam. To put that into perspective, हर सवाल के लिए 1 मिनट से भी कम time available होगा. This means the ultimate focus for candidates should be on strict time management.
Now let's look at how the exam weightage is divided. It's broken into 3 distinct sections. 40% is dedicated to English or verbal reasoning, 30% to analytical reasoning, and the remaining 30% to quantitative reasoning. अच्छी तैयारी और clear focus के साथ ये test clear करना completely manageable है, so there is no need to panic.
Now, what's really interesting about this is that the exam tests general academic aptitude, not specific clinical nursing concepts. The English section evaluates vocabulary depth, sentence completion mechanics, and reading comprehension. The analytical section requires logical deduction and complex scenario analysis to accurately assess your critical thinking skills. And finally, the quantitative section evaluates basic mathematical foundations, focusing entirely on arithmetic, algebraic equations, and fundamental geometry concepts.
Section 4. Assessment and passing criteria.
To secure a valid HEC certificate for an MS in nursing, candidates must strictly meet a minimum passing threshold of 50 out of 100 marks. And here is some surprisingly fantastic news. There is absolutely no negative marking in this exam, so it is entirely safe and highly recommended to attempt every single question. Once the test is cleared, your scorecard remains valid for exactly 2 years from the fall 2026 exam date. During this 2-year window, candidates can legitimately utilize this score for both national scholarship opportunities and university admissions.
Section 5. ETC Portal Registration Guide. Let's get practical.
Securing a spot on the portal requires completing 4 major steps. Sign up with a CNIC or B form, complete the profile, enter education details, and finally, submit the application. For step 1, candidates must visit etc.hec.gov.pk and create an account using their CNIC. To verify your identity, the portal sends an OTP via email or SMS, which must be verified immediately to proceed to the next stage. In step 2, the My Profile section must be completed. This requires entering personal information, address details, and parent details. A formal profile picture must also be uploaded. Make sure to save all changes before moving forward. Step 3 is arguably the most critical part. In the application form, the test category must explicitly be set to HAT-IV. Following this, carefully input the complete academic history of your 16 years of education, such as your BSN or post-RN degree.
The final step is to deeply review the form and click Submit. Upon successful submission, a unique application ID is generated. This ID is the ultimate confirmation of a successful registration on the ETC portal.
Save it somewhere safe.
So with the roadmap entirely clear, the biggest hurdle for candidates now is structuring daily preparation alongside highly demanding clinical duties. Will rote memorization be enough, or will strategic time management be the real deciding factor for fall 2026? Think about it. Allah Ta'ala sabko kamyab kare. Best of luck.